pathology, ischemia, types of infarcts, and free radical injury. All right, so for the first thing that we're going to be covering is ischemia. Now, once again, majority of this information on this page is going to be covered in other systems. So I'm not going to go fully in depth in this, but this is just kind of a quick overview. So what does ischemia mean? Ischemia just means that there's inadequate oxygen supply. Okay, so oxygen supply doesn't match the organ demand for oxygen, and it's usually due to inadequate blood supply. Okay, now there's two ways that the blood cannot supply oxygen well enough to an organ. Either there's a decrease in arterial perfusion, so we're not getting the blood through the arteries well enough, okay, and that could be due to atherosclerosis. That's one example. Or a second way is that we don't drain the venous drainage too quickly, so that we get that blood build up from the veins all the way back, and we don't get new oxygen and new blood in there. This is examples seen in this is Budd-Chiari syndrome, which is just a thrombosis in the hepatic vein. Okay, so the organs that they really want you to know that could potentially have ischemic effects are going to be listed in your first aid book, and the regions in which they're normally going to be cause ischemia are located there as well. This is very high yield, but once again, they don't go really in depth as they would for the rest of the systems. So I'm just going to say just an overview of what it is that they want you to know, but we're going to get into it for each system later on when I cover it. So for the brain, ischemia usually occurs with the ACA, the MCA, or the PCA with the watershed areas. Watershed areas just mean that there's just an inadequate blood supply and they're prone to ischemia because usually they could be locations where two arteries meet and there's not really great blood perfusion. Next is the heart. The heart's location usually is the subendocardium of the left ventricle. The kidneys, you could see mainly ischemia at the proximal tubule in the medulla or the thick ascending limb, also at the medulla, and that's going to be the location of the least amount of oxygen, so that's why they're increased infarct or ischemia. Next is liver. Area around the central zone is zone 3, which has the least amount of oxygen, so increased risk of ischemia. And last is the colon. These two locations, the splenic flexure, as well as the rectosigmoidal junction, are the locations in which we have an increased risk for ischemia. Now, ischemia is one thing where we have a lack of blood supply, okay, leading to a decrease in the amount of oxygen, okay? Infarcts are a complete blockage, okay? And so when we infarct, there's two types. There's red infarct and pale infarct. The red infarct is going to be located for usually tissue that has dual blood supply, because if I infarct one artery, then the dual blood supply will come in and perfuse that area, okay? And it will be red because it's filled with blood, okay? You're going to be seeing the liver, the lung, intestines, and testes as the main organs that have red infarcts, okay? Just multiple blood supplies. Reperfusion injury, though, is usually seen here with these red infarcts due to the fact that once we reperfuse that area, we had a buildup of all those damaged free radicals and metabolites from that moment of ischemia. And then once we clear that area, all those metabolites that have built up in the blood, they start to travel to the rest of the other organs without us really realizing, and that can cause reperfusion injury. That's all that reperfusion injury is, okay? Keep it simple. Next is pale infarct. Pale infarct are going to be in organs that don't have dual blood supply. And the key ones are the heart, the kidney, and the spleen. Okay? So make sure you know that the heart, kidney, and spleen have that pale infarct, and then you can remember the rest for the red infarct. But that's all that really matters. Lastly, for this video, I'm going to be talking about free radical injury. Now, this isn't too high yield. Once again, there's so many different things that can cause free radical injury, like radiation exposure from cancer therapy to our own white blood cells producing oxidative bursts and inflammation. But what we do need to know is, how do we control our free radicals? So the important free radicals are hydrogen peroxide, which is H2O2, superoxide, which is O2 minus with a radical group, and then the last one is the hydroxyl free radical, which is an OH minus with a radical group, and that's the most damaging. Now, in our body, we have catalase, which controls H2O2, or hydrogen peroxide. We also have superoxide dismutase, also known as SOD, which controls superoxide. And then, lastly, we have glutathione peroxidase, which controls our hydroxyl free radical. And glutathione, once again, is very, very, very important for controlling that free radical injury. And we're going to see the pathology associated with it is going to be our NADPH issue for G6PD deficiency, okay? And we'll touch up on that later on in hematology oncology section. But overall, that's the most important thing that you need to understand from this free radical injury portion. Lastly, the ionizing radiation toxicity. what they love to ask about is stem cells are rapidly regenerating tissue. So the most susceptible to radiation are rapidly degenerating tissue or regenerating tissue. And that's why, we use it against cancer, because cancer is rapidly regenerating, but that's why we'll see majority of the time the cells that are killed that are our own cells are the ones that are stem cells, okay? So that's why we lose our hair, because it's rapidly regenerative, okay? And that's why we'll see skin issues and things like that for cancer therapy.